Well, Connecticut was one of the hardest hit states in the beginning of the coronavirus pandemic. Since March, the state's seen more than 57,000 cases and more than 4,000 deaths from the virus, according to Johns Hopkins University. In Fairfield County, Stamford Health worked on the front lines in some of the state's hotspots. And joining us now is Kathleen Silard, the president and CEO of Stamford Health. Kathleen, really great to have you on. Can you tell us firstly about how is it going in your area right now in terms of cases and keeping this virus under control?
Good morning, Jill, and thank you for having me. I will tell you about how it's going. It is going well right now in Lower Fairfield County. I want to tell you a little bit about Stamford Health first. We're a 300-bed tertiary hospital in Lower Fairfield County with a large ambulatory network and over 700 physicians on our medical staff. And I think the uniqueness of us as an organization is that we are an independent hospital. We exist for the purposes of the community and not part of a big conglomerate. And we have clinically excellent staff that I like to characterize as kind and caring, providing great care for our community. And as you said, we were a hot spot. We had over 650 inpatients, and we were at the height of the pandemic. We were really challenged given our proximity to New York. Right now, I'm happy to tell you that we only have one inpatient here at Stamford Health. And although the numbers are ticking up in Connecticut a little bit, we have been in Fairfield County, and particularly in Stamford, we have been keeping those levels low.
So that's very good news. I want to talk about, I know your organization started a high-risk community outreach task force, and it was because you saw just these high levels in Black and Hispanic communities. Can you tell us a little bit about that initiative?
Certainly. I think one of the things we recognized early on in the pandemic was that the Black and Latinx communities were disproportionately impacted by the virus. I remember one day making rounds in the ICU, and we went from 20 to 73 ICU beds in a matter of 3 weeks. And I remember one of our critical care doctors pulling me aside and said, "Kathy, there is something you need to know. We are seeing disproportionate amount of critical illness in those two populations." And we believe that it is our responsibility as a hospital that serves our community to act with clear intent to try to bend that curve. It was devastating. I will share one story. I was in the ICU one day talking to the nurses, and I could see they were distraught. We had just lost a 30-year-old Latinx male who his wife had just had a baby. He got sick right after the baby was born, isolated, came to our emergency room and deteriorated extremely rapidly and died. And that doesn't need to happen. It was devastating. We also had a fabulous story about a woman from the Latinx community also who came in to deliver a baby, and it was evident she had COVID when she arrived at the hospital. She deteriorated very quickly. We had to do a C-section to deliver that baby, a healthy baby that did not have COVID, but she was critically ill in the ICU for weeks. I'm happy to tell you she survived and she's doing well. But that's just a microcosm of what we saw. And so we needed to act quickly and with clear intent, working with our community partners to stop the spread in those two communities. And although we are a very capable hospital and obviously a big network of physicians and caregivers, we knew we couldn't do it alone. So we partnered with other community organizations. That it's an organization called VITA that brings together the hospital community partners to impact health and wellness, and as well as access to food, healthcare, and housing. And we created something called the VITA High Risk Task Force. And working very significantly with the NAACP, Building One Community that targets its work on the immigrant population, we did so many things. We did reverse 911 calls out to all the members of the community around wearing masks, social distancing, washing, cleaning, all the things that are necessary to stop the spread of the virus. recognizing that there are a lot of language barriers. We also did that in multiple languages. And we also did it in areas where those communities would embrace this communication. So, for example, there is a lunch program in place in Stamford, and we went to the lunch programs where families and children gather to spread the word. So we had to use so many different vehicles working together with our community partners. What was most important is that we distributed masks and that we were able to communicate to them the importance of wearing that mask consistently and social distancing. One of our physician leaders, who is also Spanish, actually went on Univision, the local Spanish radio station, and spoke about how important it was to practice all of those things that will help to prevent the virus. We also expanded testing significantly. We all know how important testing is. But for some communities, coming to the hospital is scary. Either they're undocumented, or they just don't know how, or uninsured, they don't know how to navigate the system. So we went out to their communities and we worked with federally qualified healthcare centers, CHC, and Optimus that exist in our community, and we brought the testing to the people where they live. And that had a big impact. I'm happy to tell you that actually we reduced we increased the amount of testing in the Black community by 18% and about 9% in Latinx community. And that's very, very important. So it was a challenging time. We're working hard, all of this work to prevent a surge in the fall, but we are ready if it happens. And I'm very proud of our organization, how we stood up in this pandemic.
Well, amazing work, and hopefully other hospitals will implement similar types of programs. Kathleen Silard, Stamford Health President and CEO. Unfortunately, we do have to leave it there, but thank you so much for coming on. Appreciate it.